Well, hello. It's September 11th. Obviously, a somber day for many. If you're old enough to remember what happened 22 years ago today, 9/11. Yeah, wasn't the greatest day in our lives, but hopefully we learned a valuable lesson. Okay, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Nova, New Canaan. And what we're going over today, I'm going to tell you what we're going over today is COVID headaches. Yes, post COVID-19 headaches. Had a question about it recently, and I thought it'd be a perfect opportunity to start to address it because we see a lot of headaches here at Core Health in Darien. And when we go over the symptoms for post COVID-19 headaches, and what it is it's a lingering post COVID-19 headaches are headaches that can occur as a lingering symptom after recovering from COVID-19 infection. They vary in length, in intensity, and duration. They also have specific characteristics that differentiate them from other types of headaches. So let's go over some of the signs and features of post COVID 19 headaches. New onset. One of the key signs of development of headaches in individuals who have not had a history of recurring headaches before COVID 19 is a new onset headache. Never had it before, had COVID, and all of a sudden it's part of the long COVID, I guess, journey. Um, some of these post COVID-19 headaches can persist for weeks, months, even after the acute phase of the COVID-19 infection is over, a viral infection. It's considered part of the long COVID-19 syndrome. So there's different types of headaches that are associated with post COVID-19, and they can occur in various forms. Tension type headaches, migraines, sinus, um, a combination of different headache types is really what we're getting from what we're seeing with post COVID 19. Very hard to diagnose as a post COVID 19, but since we're seeing more of it, we have to put a label on it. Now, location of pain is another one of the differentiating features of post COVID 19 headaches. And headaches associated with COVID 19 recovery can occur anywhere on the head. Usually you have, you know, back of the head, side of the head, or above the eyes. But these really tend to be anywhere, and can be all over if you catch my drift. Now, again, here's another thing: is the intensity of post COVID-19 headaches can vary from mild to severe. You get some head pounding or debilitating headaches, while others just have mild discomfort. So I think you're starting to see a pattern here, which no one knows, but we don't know because we can't predict why the headaches have been as bad. But it's again, we got to throw a label on it. So this is the label. Deal with it. So duration is another issue. Duration of the attacks of post COVID-19 headaches. These headaches can be episodic or chronic. They can come or go or persist continually for extended period of time. Again, not much of an answer, but more of a description so you're aware of it. The associated symptoms. A lot of the post COVID 19 headaches can be accompanied by other symptoms: fatigue, brain fog, difficulty concentrating, memory issues, which are also common in long COVID 19 cases. So, in a sense, you really almost want to call this a post COVID 19, a long COVID headache instead of a post COVID 19 headache. But I gotta educate you people, so you just gotta listen to what I'm talking about when it comes to it. I do my research on this stuff. So the triggers, stress, which can trigger any headache. Physical activity, exposure to certain environmental conditions may exacerbate post COVID-19 headaches. Ladies and gentlemen, that is so similar to any headache, but again, let's stick to what we're describing here, which is post COVID-19 headaches. Here's the interesting thing: is the response to medication in post COVID-19 headaches is a little bit different than pre-existing headaches. The usual headache treatments are less effective. Now, why? Again, I can't answer. I'm just reporting the facts. Um, Screen time is another factor. Individuals who have prolonged screen time, such as working on a computer using a smartphone, can exacerbate post COVID-19 headaches. Here's a surprise: any headache can be worsened with excessive screen time. So it's a lot of similarities here. So what's important to realize: post COVID-19 headaches are just one potential symptom of long COVID-19 syndrome. and can involve a range of persistent symptoms affecting various organs. If you're experiencing it, go to your doctor. Now, of course, I'm going to say go see your chiropractor because I am a chiropractor and I do treat a lot of headaches. So, in this case here, if you go seek medical attention. The chiropractors aren't medical doctors. Let's not forget that. But it is something to be aware of. And if you never had the headaches before and you did have COVID, well, now you have a potential reason as to why you're having these horrific symptoms. So, what's the workaround here? Well, number one, don't get COVID. And I do see a spike in COVID claims right now. People are getting sicker again. So be careful. I'm not saying you have to wear a mask, but just beware. All right, I'm Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. And today we just discussed the symptoms of post COVID-19 headaches. They do exist. If you have them, again, go see your chiropractor, go see your medical doctor, get them checked out, especially if they're not going away and if they're interfering with the quality of your life. Have a great day. If you have any questions, you can always reach me 203 656 3636. 203 656 3636. Dr. Brian McKay. I work here at Core Health in beautiful, lovely Darien, Connecticut. And let's not forget 9/11, 22 years ago today. Worst day in American history as far as I'm concerned. All right, take care. Have a great day. And again, thank you for listening.